Okay, so today we're going to catheterize. Setting up the tray is the same as you've learned. You open up your tray, have it in the garbage here. The first flap is you're going to open that away from you. And again, nothing's changed. Open up your field the way that you know how. My forceps are gone. I've used them too many times. Anyway. So I'll just show you what is in here. Okay, so we have a fenestrated drape, which I'll show you that in a minute. We have another drape. We're going to drape our client. We have our sterile gloves, but they actually look like disposable gloves. They don't fit like our normal sterile gloves do. We have some cotton balls, we have a syringe, and I'll show you the rest of that in a minute. So first thing we're going to do is we can drape our patient. So again, picking up that corner, the first one is just going to go under their buttocks. Hey, Mr. Smith, can you lift your buttocks there for me? The second drape is fenestrated, and that means it has a window in it. And my window's been broken because I've used this before, but there's an actual diamond shape there. That's just going to go over the top of the perineum, so you can still visualize what you're doing. The other thing we need to do is add our catheter. With a female, there's 3 possible orifices, so it's advisable to bring 3 catheters for your first few times. And when you open up that catheter, it's double wrapped. So if you contaminate with the first pull, you'll see it's actually covered in plastic. So if you happen to contaminate, don't worry about that. You can rip open the other package and just get that catheter out without contaminating. Be careful it's not flopping around. Put it right into your sterile field. And we're ready to start. But before we start, I'm just going to show you what is in here. So you can actually don your sterile gloves. Again, these are the same technique as sterile gloving. You just don't want to contaminate anything on your field. Get that second glove on. Okay, so now that I'm sterile, I can touch everything within this vicinity. So in here I have some cotton balls. I have a syringe that would have a little black cap. I like to throw off that cap. I always advise that you check your catheter first to make sure that it's patent and there's no holes or leaks, and you do that by just attaching your syringe and inflating your balloon. I would inflate it all the way and just hold it to see, and you'll notice what will happen is when you take your hand off the syringe, the pressure exerted will actually empty out your catheter again. So you have to be careful with that when you're at the perineum, and I'll show you that once we get there. You'll have some sort of lubricant. I like to just open it up and I place the catheter right into that lubricant, and you will need to lubricate to use our models. So you will be opening up your lubricants, and Wendy will have extras for us. So I just put it inside there. And the last thing that you would have is you would have some container with something to cleanse with, either providodine, some sort of cleansing. Usually the providodine is the brown stuff, so we don't include it because you tend to make a mess. But what you would do is open up your package. We'll pretend that you just pour it into your cotton balls, and then you're ready to take everything over. So this is why we extend our field with catheterization. It's really hard to work from your tray, so we're going to move our entire field over to the drape that we drape with. So now, sticking with the principles, what happens now is this container is considered our sterile field with that 1-inch border being contaminated. So you have to just put your hands in like this. You can see me, and I'm just going to transfer this over to my sterile field. Female anatomy is not going to facilitate us actually visualizing the urethra like this. Usually you have to hold it apart. Sometimes you'll need someone to help position the legs or hold your patient, but the key to catheterization is being able to visualize that urethra. Sometimes having someone hold a flashlight is helpful as well. The first thing we're going to do is clean. So we clean right down from urethra to rectal area. We cleanse distal. And then we cleanse proximal. And I have 5 swabs, so I like to use them all. So I'm just going to cleanse again, right down the most sterile part, which is her urethra, and I'm going to go one more time. Okay. Next thing I'm going to do is I can discard that. I'm going to pick up the catheter. It's lubricated. I visualize how far it's going to go in for a female, and that is my guide. But as I'm inserting, I'm having to take a deep breath, take a deep breath into this last curve, and just breathe. And I'm inserting, and as I'm inserting, I'm watching here, because as we go into the neck of the bladder, you're going to see urine coming out through this little hose here. You don't want to have that pointed up. You want to keep it pointed down, and then when I see urine, I usually go another centimeter to 2. I'm going to secure the catheter while I inflate the balloon. Remember what I said about taking your hand off. If I take my hand off, what'll happen is the balloon will deflate. You want to keep your hand on. Once you have inflated the balloon, you're just going to give a gentle little tug here to make it secure. And I'm going to take my hand over here. Keep it pointed down, and I would have my urine bag ready to go. I would flick off the lid and insert into the catheter, and I've hooked up straight drainage. This here, again, this would be connected, so what you could do is you could just rip that open. And if you're measuring urine, this is actually, this is calibrated into measurement. So if you had to measure the amount of urine that you emptied, that is right there.